Canada's greatest threat from COVID-19 is south of the border. We're sealed off from the alarming spike in cases in the U.S., but only as long as the U.S.-Canada border remains closed to all but essential travel. That agreement is set to expire July 21st. And today, Prime Minister Justin Trudeau says he is not traveling to the U.S. He's just turned down an invitation to visit the White House on Wednesday. Our Ottawa Bureau Chief Mercedes Stephenson joins me. Mercedes, bring us up to speed.
Donna, Prime Minister Justin Trudeau will not be attending that summit in Washington, D.C., despite lingering concerns about potential aluminum tariffs for Canada. Instead, Justin Trudeau will remain here for cabinet meetings and a rare sitting of Parliament, not to mention that much-anticipated fiscal snapshot. But senior government sources did acknowledge concerns about COVID-19, and a potential 14-day quarantine upon his return also played a role in the decision not to go. The border is a concern not only for the Prime Minister, but for many Canadians as they watch COVID-19 cases surging in the United States. And while the border has been closed since March 21st, international air travel has doubled over the last 2 months. The number of passengers arriving from the U.S. and other global destinations has increased from 15,000 people a week in April to 30,000 a week in June. Since May 25th alone, 135,000 air travelers have arrived in Canada. 66,000 of those travelers are not Canadian permanent residents or Canadian citizens. So what are those 66,000 people doing in Canada? The Canada Border Services Agency couldn't give Global News a breakdown, but said all 66,000 are considered exempted foreign nationals, which includes essential workers like medical workers and temporary foreign workers here to labor on farms. But one infection control expert at the University of Toronto finds it hard to believe that that sudden spike is all essential workers and wants a clearer definition.
I think it's really important that we have a national conversation about what essential travel really is.
The concern isn't just about Americans and international travelers who come here, it's also about Canadians who come home but ignore self-isolation rules.
Clearly, some people who say that they will be self-isolating but aren't, and they are putting all of us at risk, and this is not acceptable.
Dr. Colin Furness warns that the closed border may be the new normal for as much as a year, warning that the warm summer weather has given many a false sense of security.
Getting away with a lot, but when September comes and the weather starts to cool down and people start to move inside more, maybe a little bit less vigilant after a few months with very little community spread, we might really be facing a catastrophe.
Donna, according to Health Canada, contact with a traveler accounts for only 1% of Canadian COVID-19 cases. And on top of that, international air travel, even with the recent spike, is still down by about 95% from where it was at this time last year. But there is still pressure to reopen the border. Nearly 30 congressmen and congresswomen signed a letter to the Trump administration advocating for an end to the constant 30-day extensions of the border closure and saying it's time for a phased plan for reopening. Donna?
Mercedes Stephenson in Ottawa, thank you. The United States is on track to shatter another COVID-19 record as infections there surge across the country. Nearly 3 million Americans have now tested positive for COVID-19, and that number is ticking up at an alarming rate. According to Reuters, 16 states broke records for new cases in the first 5 days of July. In Florida, more than 10,000 people tested positive yesterday alone. Officials in Miami are now reimposing some restrictions, though as Jackson Proskow reports, many Americans still aren't grasping where this could be headed.
This is exactly what health experts feared. Packed beaches and parties over the 4th of July weekend as COVID-19 cases surge in the majority of states.
Right now, the virus has the upper hand throughout much of America, most of America.
Defiance now seems to be the only national strategy in the U.S. In Florida, which set several daily records for new cases over the weekend, the governor insisted everything is fine because most of the thousands of newly infected are young.
If you're under 40 and you don't have significant comorbidities, the fatality rate for this is pretty close to zero.
That echoes a weekend claim from President Donald Trump.
We show cases, 99% of which are totally harmless.
Who has alternated between ignoring the virus and suggesting Americans should just live with it, to the dismay of those who've already suffered the worst of it.
And now the country is suffering because of the president. And it's time for him to change course. It's time for the president to actually tell the truth.
The U.S. has the highest number of total cases, deaths, and daily new infections of any country on Earth, and has still not reached a consensus on measures like masks and physical distancing.
I think the world is looking at us as a leader in COVID-19.
The White House continues to argue there's only one indicator that matters, the death rate. It's down from its peak. That likely won't last. Hospitals are already overwhelmed in a growing number of states.
Getting used to surges in hospitalizations and deaths is not something that any of us could really get used to. And nor should we really try to get used to this.
In a sign of where it may all be headed, Miami has decided to roll back on reopening as cases there surge, shutting restaurants, gyms, and clubs for a second time. Jackson Proskow, Global News, Washington.